I'm Dr. Christopher Sundy with Nova Health Recovery Ketamine Infusion Center, and I'm going to discuss ketamine microdosing and home ketamine therapy in more detail regarding what we do with different patients and what kind of treatments and possibilities that it offers. Now, ketamine has been around since 1962, was FDA approved in 1970, and it's an extremely safe medication. In anesthetic doses, it maintains a person's blood pressure, pulse, and pulse oxygen breathing. But when we use it for depression and mood disorders, we're using sub-anesthetic dosing, meaning really low doses that really are extremely safe. And we do these infusions in rooms such as this, in which the person is comfortable. They basically sit back and relax. They get an IV in, and the infusion lasts between 40 to 45 minutes. The individual has monitoring during that period of time, and they're completely comfortable in a home-like atmosphere. And ketamine comes in a number of different strengths as an IV formulation, and it's utilized at different doses depending on what the person needs. Generally speaking, for depression and mood disorders, it's between 0.5 milligrams per kilogram to 1 milligram per kilogram over about 40 to 45 minutes. But higher doses and longer durations of infusions can be used for painful conditions such as CRPS, chronic regional pain syndrome, otherwise known as reflex sympathetic dystrophy, and specific neuropathies will require higher dosing. Sometimes we will add in magnesium to augment the effect of ketamine, and other things can be used as well to help out with the ketamine infusions. But the main thing that we see as a side effect during those infusions is nausea, for which medication is given to premedicate against that. Now, the goal of any type of ketamine therapy is obviously to help decrease depression and help improve mood disorders and decrease pain. And obviously, one of the largest problems with mood disorders and mental health is suicide. And obviously, ketamine has played a significant role in its effect on its anti-suicidal abilities when it's given in its, as infusions. And it augments the effects of traditional antidepressants as well. So the initial studies of intranasal ketamine go back to 2014, where Lapidus and his group actually did a randomized controlled trial using intranasal ketamine in major depressive disorder. And they basically discovered that individuals who are treated with intranasal ketamine in a specific fashion, in this particular case, they used 20 patients with major depressive disorder, and they used 2 treatment days with intranasal ketamine at 50 milligrams. And they found that 44% of them had a improvement in their depression within 24 hours after the initial treatment with intranasal ketamine. And so this is actually trying to use intranasal ketamine from the ground up. Generally, we use the IV formulation because it is rapid, it is effective, it is robust. And we have about between 60 to 80% of patients have response or remission from their depression after a series of 6 infusions over 2 weeks. Generally, people will get 2 to 3 infusions per week over those 2 weeks of escalating doses up to a certain percent. And then we use a microdosing of ketamine as a maintenance therapy for home use. And this has been utilized by a number of different physicians over the years effectively and for a number of different reasons. And so what does microdosing mean? Well, it means you shouldn't feel anything at all. It's a micro dose. And that's really what microdosing is that you shouldn't be feeling anything. And so ketamine works through neuroplasticity. It works through the glutamate system, unlike any other antidepressant. It effectively treats the ability of your brain to increase its synaptic and neurosynaptic plasticity. The increased number of synapses basically decreases our depression. And that's a very superficial explanation of what it does. So the benefits of microdosing ketamine are maintenance of your antidepressant effect in between ketamine infusion boosters. And after you do your initial series of boosters, you'll need to have periodic ketamine infusions. So you do your series of 6 infusions, and then you do monthly boosters, or even more frequently if necessary. But it has been found that there's some benefit of microdosing of ketamine in between those infusions to basically allow an individual to go longer potentially or feel better in between those booster series. Also for pain management and augmenting pain management, especially for chronic painful conditions such as CRPS and central sensitization or neuropathies. Topical, oral, and intranasal ketamine can sometimes augment the underlying medical treatments that the individual is undergoing. There's also the ability of microdosing to augment the antidepressant medications that the person is on, and even when they change their medications to help them work better and faster. And then there's also post-acute withdrawal syndrome in patients who have been taken off of opiates or even Suboxone and then been placed on injectable naltrexone, otherwise known as Vivitrol. Those individuals sometimes feel with low mood or depressed, and that is also a cause of relapse in a lot of these individuals. They just don't quite feel right, and that is something that is really important to treat and be aware of. So microdosing can certainly be helpful for those individuals. And then there are also the individuals who are suffering from alcoholism or cocaine use disorder. Maintenance and relapse prevention for these individuals can also be helped by the use of microdosing of ketamine. Individuals with Lyme disease, anxiety, intermittent explosive disorder, and quite a few others have had effective treatment with home-based ketamine therapies. So the methods of microdosing ketamine for home use include things such as compounded nasal ketamine. And this is racemic ketamine, not Spravato. And Spravato is actually just the left-handed form of ketamine. And the types of ketamine that are generally used for intravenous use or compounded have both the right-sided ketamine and the left-sided, the mirror images of each other. And then there are also oral ketamine treatments as well for home use in ready-to-dissolve tablets, troches, and even liquid. So as I mentioned, when you receive IV ketamine, you're getting the right-handed form and the left-handed form at a 50-50 mixture. So the left-handed form is Spravato, the right-handed form is R-ketamine. And there is a difference in how they interact with the receptors and their efficacy, but you're getting, again, a 50-50 mixture when you do microdosing, IV ketamine, and home ketamine therapies. So for ketamine tablets, generally most people will use, for example, ready-to-dissolve tablets as a preparation that they put under their tongue for about 10 minutes. And that's where they get the best results. They get better absorption under the tongue where the venous plexus there kind of sucks up the tablets, and then it just kind of gets into the system itself. And these are to only be used at home, and there's no driving for several hours after use. The individual's dose will vary per need. And sometimes you may feel more when you use these types of tablets than other times. And that can be either due to inconsistencies in the preparations, or it could be the way that you held it under your tongue. But the one thing that is consistent is the bad taste. So these can be flavored. And only about 20 to 50% of the RDT is absorbed. And its effects start to be noticed within about 5 to 10 minutes. And it's definitely different than an IV formulation. You should really not be feeling much, though, again, to do microdosing for home therapy. Effectively, you're just trying to maintain neuroplasticity with these types of treatments. And oral ketamine for home use comes also in a more firm troche, which, again, these are kind of like a butterscotch type feeling and consistency to them that are just taken out, placed under the tongue. And then, of course, the RDTs are a little bit more chalky. Then there's intranasal ketamine, a nasal spray, just like Spravato, as you may know it. And intranasal ketamine is compounded at the compounding pharmacy. It is definitely rapidly effective and better absorbed than the oral formulation, to the tune of 80% potentially. And it tends to crystallize at higher strengths. So individuals will use multiple sprays throughout the day, and that's just one of the methodologies of using this for depression. But pain management and depression use varying amounts of the nasal spray or the tablets. It just depends on the person's needs. Sometimes more is less when it comes to mood disorders. So too much doesn't really help out. And the goal is not to have a voyage, but basically to not feel much of anything, just to keep the neuroplasticity going. So as far as augmenting how that nasal spray works, you can certainly use neti pots and atomizers to augment the effect, and that allows your nasal passages just to get cleaned out. Leaning your head forward will prevent seepage down the back of your throat because that causes the loss of effectiveness. And of course, effective use of home ketamine therapy is really you utilize booster infusions and you continue your underlying foundational treatment for your underlying conditions, especially when it comes to alcohol use disorders, cocaine use disorders, and opiate addiction or PAWS, post-acute withdrawal syndrome. And so individuals who are treated for their underlying addiction disorder and are stable, for example, if they're on Vivitrol to block all the opiate effects, or constant Suboxone, or Sublocade, which is a monthly injection of Suboxone, or other types of treatments, and they suffer from mood disorders, IV ketamine therapies can certainly be effective in depression and bipolar depression, but also you can use microdosing and home-based ketamine therapies for those that benefit from the mood stabilization. Side effects of home therapy include misuse, excessive use and abuse, dizziness, nausea, dissociation, burning in the nose, a bad taste of the medication. And the other issue is that if you get a urinalysis, ketamine shows up as ketamine or PCP in the urine. So if you're getting regular screens, then your doctor or the individual testing you needs to know that that's the medication that you're on. So again, we monitor for abuse and misuse. We monitor for side effects. We monitor for functional improvements such as motivation, cognitive function, and mood. And the use of microdosing and home ketamine allows for augmentation of your underlying treatments and psychotherapy to improve cognitive behavioral therapy and decrease cognitive rigidity. It also allows for a longer duration of response between booster ketamine infusions. At Nova Health Recovery Ketamine Infusion Center, we offer home-based oral RDT, troches, tablets, and intranasal racemic treatments as maintenance therapies, and have found it effective with minimal side effects.